Welcome to our 10th video in the series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We're now into week 7 of Maddie's post-op rehab progression, and the main thing we want to do is ensure that full motion is maintained, progress her strength base without restrictions, and integrate basic functional activities as we discussed last week. Now, the reason we want to focus on progressing the strengthening is because often once we get to the functional part, people put so much emphasis on this, they forgot to work on maintaining the strength base, and problems develop down the road. Now, as we look at the exercises here, such as the hip abduction, we see that now we're doing it in a freestanding position to incorporate more balance. And as we go through this video, we want to look at the different compensatory movement patterns and movement dysfunctions that we see, as we're going to have to refine these as we go through the process. You can see here as we go through the squat, looking from the side, she has smooth controlled movement, has good spine angles, and appears to have a good depth of squat. When you look at it from the back, you can see that Maddie deviates to the right as she goes down, keeping some of the weight and the pressure off of her involved left side. The similar thing is seen here on the lunge as she goes forward with her involved leg to the back. You can see she leans forward and her knee comes forward too far, in part because of tightness in her left hip flexor. On the uninvolved side, you can see that her body position after her first little wobble gets much better. She's much more upright and her alignment is much better. It's little things like this that we'll have to look at and pay attention to as we're going through. We also want to start incorporating more core stabilization activities in a slow, controlled manner, doing some alternating arm and leg lifts, and you can see that on the stability ball she's really fighting to do this in a slow, controlled movement, whereas she could have done it very quickly without much difficulty. That's why we always want to emphasize the control of movement when we're working on the postural muscles. We put on a dynamic surface here on the dynadiscs, and you can see as she goes down, there's going to be a lot of compensatory movement patterns. There's a lot of forward chuckling to displace her center of gravity, and you can see a lot of movements both at the hip and the ankle as she tries to maintain her balance. A lot of this becomes more apparent from the front. We give her the cue of trying to keep her feet flat as she goes down, and you can see as her weight shifts and her center of gravity deviates, as is shown here where she goes into a squat. It emphasizes her deviation to the right away from her involved side. Now when we look at the lunge and break it down, the body angle in yellow is too far forward when her involved leg is back. Her knee position is too far forward over the toe, as is shown in blue. And the depth of squat is actually good on both sides, as is shown in red. Now when we take away the stability provided by the TRX and look at her walking lunge, we can see that these issues even become more emphasized when the left leg is back. Her spine angle isn't perfect on the right, but it's certainly too far forward on the left, and you can see this from the back. Not only does it affect her hip position, but also the trunk lean that you see as she's going through this process. Now we want to also start integrating some basic agility patterns. You can see here for the first time she's walking through the agility ladder. Most people want to emphasize the speed of movement, whereas I want to emphasize the quality of movement, looking for symmetry, looking for cadence, and looking for even movement patterns. Now we're switching to a lateral single plane motion. You can see her just doing a high step from side to side. We also want to emphasize the arm swing, which is often neglected as most people are so focused on trying to get their feet moving that they forget that the arms move along with the feet just like it would in running or in normal activity. We're at a bit of an advantage because Maddie's gone through these agility progressions before in her previous rehab. So for week 7, we progressed the strength base, integrated functional activities, improved core strength, and progressed to higher level balance activities. If you have any questions from this week, please post them on the forum. Thank you.